Hi, it's Dr. Mike Markou. Welcome to March. So many times during my consultations, I'm asked, what do I think is important in choosing a hair transplant doctor? Well, number one, meet the doctor. Make sure your consultation is with the doctor. Only the doctor should examine you and present to you a plan of action of what he can do and what he cannot do. Just meeting with a consultant doesn't cut it these days and never should have. Too many consultants out there are promising what cannot be done and what only a physician should be going over with you. So meet the doctor, number one. Number two, what kind of experience does the physician have? For example, I have 25 years experience. I present patients with every method of doing a hair transplant, from the strip method to follicular unit excision, which now we use robotic, as well as non-surgical treatments and even medical treatments. If there's a treatment that's valid for hair restoration surgery, the physician should be able to offer to you and should have vast years of experience offering all of those solutions to you. Be especially careful when you walk into a center where they have one device that they offer or promote, because that may be a center that bought a device to get into this area of medicine. They were perhaps told by a representative of that company that they could enhance their practice without even having experience or proper training. So be careful of that. Number three, the doc's team. The doc's team is almost as important as the physician himself. What kind of experience do they have? How long have they been with the doctor? Did the doctor train some of these members of his team? Too many clinics hire out a team that comes from sometimes out of state to almost perform the surgery for the physician. Stay away from this. There is enough of us physicians who have been doing this for years, who have our own team dedicated to us and will provide you with the best result possible. So, number four. Well, some physicians do have a patient coordinator, which will meet with you before and after you meet with the physician. That's how I do things. You'll meet Kelsey first. She'll go over your paperwork. She'll explain to you what's in your folder, and then I'll come in and go through everything with you. And at the end, she'll recap and maybe answer some questions that I haven't answered already. And of course, I'm always available to come back in the room. But what she does not do or ever do is pressure patients into doing a procedure. That's not her job. Her job is just to finish up, give you your paperwork. If ever a consultant asks you, what can we do for you today for you to sign up for the procedure today? Well, walk out the door. That's not the way to go about choosing your procedure. So what else? The price should be fair, not too high. Be careful if it's really, be careful if the price is really low, because you might be getting what you pay for. And be careful if it's very high, because that shouldn't be necessary either. Look for a fair price. Do your homework. Visit with a lot of physicians, and feel free to always call me and ask me any questions you have, or email me at markou@markoumedical.com anytime. I answer my own emails. It's great talking to you guys, and I hope to see you soon.